thank you. Welcome everybody to Building a Cannabis Industry, Expertises and Assessments. It's a great pleasure for me to have Stephen Murphey with me on this panel. He's the CEO of Prohibition Partners and one of the most consistent voices for evidence-based cannabis reform and data. Prohibition Partners is one of the top sources for qualified information when it comes to cannabis. Here I'm in Germany on the board of the German Industry Association. I do a whole lot of things. You maybe know my medium Crowd Invest.de, where also we've been publishing all kinds of information also in collaboration with Prohibition Partners. So we are both looking for a very long time, Stephen and I, at unlocking the full potential of cannabis. And we both believe that the majority of this potential still lies ahead of us. So, but what does it mean to unlock this potential? We need to learn from the past, understand the present, and design for the future. And we also, this is why for today's session, Stephen and I, we will have a look at a little bit retrospect, what has happened in the past. We'll look at where we are now, and then we will talk about where the biggest potential for cannabis lies ahead of us. So, Stephen, what do you think? Like, if you look back in since you started, or maybe you can give us a little bit an insight on how you started and what has happened and what were the most interesting things that were for you the most defining or disruptive moments in this so far.
Yeah, hi, and thank you, Lisa, for that. So when I started out in the cannabis sector, and seeing. Essentially, my background was in media and data, and I liked working in terms of changing perception or changing the narrative. And as a kind of an advocate for free markets, certainly an advocate for cannabis and cannabis reform, seeing what was happening in North America and the opportunity to replicate that around the world was far too tempting, and hence jumping in with both feet back in 2017. So we first started covering the market and trying to understand, all right, what's actually happening here? Because there was snippets of information. It wasn't widely covered as obviously it is now. So when we first started looking at it in a global context, we found there was maybe 11 markets that had some sort of federal legal framework. That is, that's not including the US, but 11 or 12 overall. Today we're over 100 around the world, excluding the US, which just demonstrates just how quickly this is evolving and being adopted and localized around the world. I think the most fascinating thing is, at the speed in which it is being adopted, and the scary thing is the isolation that is happening as each local market adopts regulation for their own jurisdiction, and the lack of, a global entity or a global body. And I know there's various initiatives that have been created, thankfully, over the last maybe 12 months. The Global Cannabis Summit being one that was just in Washington, to try and bring these shared issues together, so I suppose each market doesn't suffer in isolation. And those issues are actually, repeat themselves market by market. They repeat themselves insofar as, they repeat themselves, say, a market legalizes, but it doesn't think about the access program, or it legalizes and it doesn't think about the commercial route to market, or there's various things when it comes to market access or market adoption that has stalled, and the result is it creates a grey space to operate, which doesn't protect the consumer, which doesn't protect society, and it's the nemesis of a regulated legal cannabis industry.
Yeah, I agree. Like, I would also see it like that there's these cycles repeating itself, that there's these bottlenecks. Where do you think that real potential was activated, and where do you think did we waste an opportunity?
Like, cannabis it's obviously not new, and even legal cannabis, like, you go back to 2012 and Italy adopting legal cannabis and creating their system and so forth. Obviously the biggest light bulb was when Germany, when Germany happened, a G7 country, adopting legal cannabis and saying, actually, okay, we want to set out a system, and this is the system we want to set it out, and embellishing it into or integrating it into the actual healthcare system. That's a massive, recognizing the legitimacy of it. So I think the missed opportunity is where, one, you recognize that it's that it's legitimate. In say in the case of the UK, for example, you recognize the legitimacy of legal cannabis, so you create a legal framework. However, you don't move past that in terms of integrating it into the healthcare system, which allows for or creates the need for entrepreneurs to ultimately fill that gap, but those entrepreneurs, many of them don't have the sufficient healthcare experience to actually, as they're not trained healthcare professionals. So by the time the standards rise, you're talking 5, 6, 7 years. So you're only now seeing cannabis healthcare providers who actually are providing the same service that's consistent in other healthcare areas. And I think that's a massive gap. We can go down
we can go down that rabbit
adult
hole.
use, the split between adult use and recreational. The reality is,
or hemp, even like the thing that you said about Italy is super interesting, because I remember back in 2018 when the CBD boom was happening and Austria went more restrictive, all the Austrian suppliers, they moved to Italy because it was like a refuge. Yeah. And now it's like basically they're coming up and trying to kill the industry in Italy, which is super interesting development to see.
Yeah, and I think it's what you're rooting the legalization and the regulations on. There has to be an intersection of commerce, of society. Like, what are you judging the success or the downfall on? Are you judging it on the fact of say in Germany, there's suddenly the question or the safety net of telemedicines is being questioned. Yeah. So what are they judging that on? Are they judging that on the number of prescriptions that's going through? Or are they judging it on the actual impact of healthcare? They
don't even know these numbers. There's no reliable data here if you are looking at it, actually, because we don't really know how much cannabis was de facto legally prescribed in the private situation.
So it's a bit it's kind of insane. Like, one of to mark the fact that very little of our decision-making factors in this space is rooted in data or evidence, is bound to lead to issues. Like, look, we run a data platform. We produce produce and provide information on pretty much what's happening around the world. Now, say we work with a group and they are planning to build a £40 million or $40 million facility to cultivate cannabis. Not one of them has asked how much is already under canopy, how much is in demand, what's the pricing forecast. It's simple fundamentals
they also
are missing.
Sell 2 tons in 1 month, and it's underestimating a whole bunch of things. But it's super interesting because we have this number now standing here for Germany. We're almost at 1 billion in market volume in Germany at the moment. I reckon it's already bigger because of all the medical prescriptions and the boom that this market segment really has. But how big do you think the market really is, and how can we help unfold this market potential?
Well, I think it's this is the. I always say, if you put cannabis on a growth curve, we're not even at the start of the growth curve yet. And the reality is, it's because everybody understands, the existing consumers already understand the format of the product. But the format of the product hasn't really evolved yet. We haven't seen new formats yet. We haven't seen new innovation in terms of the applications to different conditions. We haven't seen a whole wave of innovation that is happening within, say it's happening in North America. You're seeing a whole new adoption of consumers who've never tried cannabis previously but didn't want anything combustible. So they're happy to, and I think this will open up a whole new sector. You're seeing, a massive decline in alcohol sales. So, but they want, it doesn't mean that they don't want a buzz or they don't want something to consume. So suddenly you've got this aging demographic who have never had any interaction with cannabis before, being served up products that are more to their taste, more to their standards, and then this young generation that are abandoning and moving away from alcohol and want alternatives. So you're kind of touching both ends, and it shows just the scope in which cannabis can actually grow. Like this is fantastic and this is amazing, but this can be done. You look at the Web Summit in Portugal, 100,000 people come in and all businesses. Like, this is where this is going to go.
But do you also reckon that there's a lot of reform fatigue maybe, or I also see personally a lot of political backtracking when policies are pushed and they're not all thought through, maybe it's passed too quick or too much on a push, and then they have to change it or even retract. Like we have this discussion now that they're talking about taking cannabis as a medicine back to as a narcotic, which would be like a loss of so much progress.
Yeah, but this is kind of when it's in the hand of politicians who have clear mandates, and the mandates are for a certain period of time. Like, I've gone to Brussels many times and presented to different interest groups and so forth. And what happens is you go and you meet a select number of MEPs, and then you come back and the MEPs are gone and it's somebody else. So the education process change and the knowledge shared, the knowledge transfer departs with that. So every time they come on board, there's no consistency in terms of, now, obviously in Germany you have a little bit more integrated regarding bee farm and the knowledge there, but in a lot of cases they're also playing catch up in relation to their understanding. We will see continual reform. Like, the biggest impact obviously comes from the US on a federal reform basis. If the federal reform basis happens, then it's a rewriting
for that.
And then it's a rewriting of the UN, and that's
so you say it's also important to work on a EU level, on a United Nations level, WHO level, to create these global regulations and not only these bottlenecks in the markets.
Yeah, and it's there's only a finite amount of resources available to work on this legislation as well. So it is done in piecemeal. I think expecting all these issues to be resolved, in the short term it's a bit naive, and as frustrating as it can be, regulatory changes are slow to roll out. It involves, it's a diplomatic process, so it does take significant time. Like we see it in the UK, or we see it in the UK. You have a piece of policy that takes maybe 3 to 4 years to get enacted, and then once it's enacted to be worked on and to be integrated in as part of business or as part of operations. I think that's a massive barrier.
Yeah, it takes very long for the process to come in place, and I personally feel it's also very reactive, like that we have to push and then the things are changed. It's not that it's like proactively talk about how can we improve this, how can we make it better. What do you think about this?
I always say we're, as an industry, we should be empowered. Like, we're empowered by the regulation and the laws and the rules we have already available to us. Like, if we were waiting for something to change, none of this would have happened. So, I think the industry obviously has always been pushing as close against regulation as you can do without obviously crossing that threshold. But I think it is critical that it actually does, because one, then you can advance at speed, which is the aim of the game when you run a business, of course, and work in a commercial system. There's obviously needs to be social policy that protects social health and so forth. But if you're operating, in this space, you are consistently challenging and testing what the limitations are. Hence, GMP washing. Yeah. Is it right or wrong? It's legal.
It's happening.
It's happening. It's obviously wasn't clear in the guidelines, so somebody found a workaround and they exposed it, and the result was able to, change what the supply chain looks like. Now, the ethics of is it right or wrong, etc. It's not for you or I to decide. It is really, it is unfortunately, the regulators needing to be reactive, but also regulators being involved in the industry, not just having those management bodies or the offices of cannabis. Not every country has it, but they are integral to actually work hand in hand as the industry evolves and these issues develop.
Yeah, I agree, but I also feel like it's very much reactive, and again, like that we should push for more discussion in this and create more awareness, because otherwise the decisions are taken for us. And I also reckon that we should definitely see also a little bit more in the perspective and what this market can become. So maybe let's do what Dirk asked us in the beginning and have a look in our, I don't say glass bubble, but grass bubble, and see if we can, what do you think, will this industry look like in 50 years from now?
50 years, it's...
Maybe 30 or 10.
I think it will look like any other. I think the split will become clear. Where we're still in a space where is it adult use? Is it medical? I think that becomes a little bit more developed. I think the integration of cannabis in those spheres for consumerism becomes a lot more established. I think, backed by clinical trials, backed by new delivery methods, backed by further integration within the rest of your healthcare treatment. I think there'll be a gradual split between both, because there is, of course, the grow your own movement and self-medication, but it'll become quite clear cut in terms of what's adult use and what's medical. So we will see and
hemp. Don't forget the hemp.
Well, yeah, of course. And I think it's something we would love to see. We would love to see more of. I think it's insane how underappreciated or even undervalued hemp is. And yes, it gets pushed aside in a lot of these conversations, because just talking about cannabis, you can talk about medical cannabis and adult cannabis for days on end.
Yeah, and I think it's a complex kind of thing. You can also grow medical API from hemp, those things. We do not do these kind of things at the moment, and I reckon that we will have way more improvements and way more access. But I also feel that there is a strong push against these developments, because the people are just so scared. They are primed with 30 years of propaganda. So what is the message you would share with, for example, regulators, policymakers, or also maybe industry leaders sitting in our audience here that are looking to shape the discussion?
I think it's quite clear. Look, we run an event in London called Cannabis Europa, and we've been running it since 2018, and essentially it's kind of in most cases it's a suit and a tie with cannabis. It's how we get regulators in the room when we get them talking about cannabis, and to demonstrate this is professional and grown up, and we're giving it serious thought here. I think for them, look, they need solutions. This is the thing. This is what business leaders or the industry needs to provide to regulators, is solutions, not problems. And that happens an awful lot of the time, that they are not being present. They don't have the time to think about a lot of the issues. And also the industry understands the problems a lot more. So I would definitely encourage, and this is why, trade associations are getting stronger and stronger in that aspect from a leadership perspective, of being front and center of providing the solutions to these issues. Be it, okay, there's a question now about telemedicines. Okay, what is the industry responding as this as a self-policing standards? Look, the alcohol and tobacco industry has mastered it. They have mastered it. They have seen potential regulations 10 years down the line, and they've come up with solutions, be it single-use devices, be it plain packaging, etc. They have been finding solutions to self-regulate, and this industry needs to move quicker at the self-regulation perspective if it is to, if we're going to, survive the onslaught of consistent policy changes.
Yeah, but especially if you look at how Like if you look at how the industry regulates itself, it's just like you can see this live with the medicinal cannabis prescription and with the private clinic operators, and that's what happens. But how can we like maybe create more reliable solutions that are not necessarily just best workaround, but true best practices?
Well, it's like most policy. It evolves. I don't think this is going to be stagnant. You've got early stage supply chains. So the supply chains are relatively novel, and you've also got a substance that has traditionally been prohibited. So it's not you're not going to. It's not going to be a smooth overnight transition. And I think that's just the nature of it. You're always going to have some political, or not political, but regulatory upheaval or renewal or review. And I think that's why I say the trade associations working more on self-policing is the way forward.
I agree. Like we have the same situation, for example, in the German Industry Association. We're currently working on code of conduct. We have also steady collaborations with a whole bunch of different industry associations that you can also see here on our program throughout tomorrow. I think is a very interesting one with the Swiss industry representation. And I think these strategic collaborations are super important. How can we improve this and make it even more collaborative industry?
But it's super important. You mentioned Switzerland there. The most fascinating program taking place around the world. Like, people don't realize there is like full adult use legal in Europe. It's happening, you know?
Under scientific umbrella.
Under a scientific umbrella, of course. But the system is in place. And the rollout and the evidence and the data they're capturing and what they're reporting on is fascinating. They're reporting public health. They're reporting crime. They're reporting a whole range of conditions that they're measuring, and over that course, they are making these informed decisions. You know, that is a rational and sensible approach, and you can't argue with the results of that test. And I think, you know, France is obviously trying to do something in its own right.
You see how it gets argued a lot, even though the data proves otherwise. Like we can see this here also in Germany, how it's actually like really positive effects with the legal access. But still, like some conservative politicians, they are focusing on the dangers of THC rather than the dangers of the illicit supply situation, and that we don't have a good access situation where we don't have shops, we don't have all these kind of things, and all these things that we have, the problems that we have in Germany particularly, I think they're a lot systemic. There is because the system is wrong, and not because the people don't want to, but because the environment and the rules and regulations that surround it are just not fully right yet.
Well, yeah, because it goes into what they can argue, what they can and can't argue against, and you're always going to have the challenge, like Citizens Assembly in Ireland, you know, is heavily skewed. Not everybody is in the cannabis camp, and that's understandable. We've had a long winter of prohibition. But you definitely have an increasing appetite for, you know, data-led conversations. So it's getting, you know, cannabis has always been emotional, and while emotion is important, while you say, look, there's a child here dying because they can't get access, and that's really important for forcing through policy change initially. So, and it's been really important in a lot of countries of saying, look, if they don't get their prescription, they will die. And obviously, any human will overlook their moral conflict on cannabis and make sure it happens. But now we're moving on to a different point. We're going, okay, we're talking about one child to 1,000 children and so on. So different systems have to be put in place. And then it becomes a very data-led conversation. And unfortunately, the data we have had to date, you know, has been limited. So that is also changing as well. That's why Switzerland and Germany, authorities working together is critical, because you look at what Canada has. Health Canada has a whole host. You look at what TPA in Australia have.
They have wonderful data in Canada, and they provide a lot of information also through the governments. Like I reckon in Germany, they still should provide way more information that is transparent, that is not branded, that is independent, all these kind of things. Or it's also, I think like the irony in what you just described, because you have all these people arguing against cannabis, and they are highly emotional actually, and then you have like a very rational explanation with like, hey, I want to help somebody who is dying, and this is actually the more rational thing to do.
Yeah, and it's great. Look, this globalism of cannabis is going to accelerate. We're seeing the working parties of groups going from France all across Africa, all across Asia. Like, we're getting calls from different countries that some you've never even heard of, or who want to adapt a cannabis policy or principle, but they're unsure how, and suddenly they're connected with the German government. They're connected to a different government. So there is this appetite for knowledge sharing, and that will help shape this global policy or this global charter that we continuously talk about.
Yeah. Thank you. I think our time is almost over. My next panel is in the back, maybe already ready and over there. But first off, let's give Stephen a round of applause. And thank you everyone in the audience for listening to us.